Welcome to the channel, guys, where we bring you essential health insights to empower you on your wellness journey. Today, we're diving into a crucial topic. Warning: 12 skin signs of liver damage you can't ignore. Your skin often reveals hidden messages about your internal health, and when it comes to liver damage, these signs can be subtle yet significant. Stay tuned as we uncover the 12 skin signals that could indicate potential liver issues, and learn why paying attention to these warnings is vital for your overall well-being. Let's embark on this informative journey together and prioritize our health by understanding these important skin signs. Starting with number 1, jaundice. Characterized by the yellowing of the skin and whites of the eyes, arises from heightened levels of bilirubin in the bloodstream. This condition often indicates an underlying problem with the liver, gallbladder, or bile ducts, disrupting the normal processing and elimination of bilirubin. Common causes include liver disease, hepatitis, or obstruction of the bile ducts. Diagnosis typically involves a physical examination, blood tests, and sometimes imaging studies. Treatment depends on the underlying cause and may involve addressing the primary condition or providing supportive care to alleviate symptoms. Before we continue to the next sign on our list, make sure to like this video and subscribe to the channel so you can get more health-related information through our videos. Let's move on to number 2, spider angiomas. Characterized by small spider-like blood vessels on the skin, are frequently observed on the face, neck, and upper trunk. These vascular abnormalities often appear as a central red spot with smaller radiating blood vessels resembling spider legs. They are typically benign and asymptomatic, but may be associated with liver disease, hormonal changes, or pregnancy. While spider angiomas usually do not require treatment, individuals with underlying conditions may benefit from addressing the root cause. Treatment options include laser therapy or sclerotherapy for cosmetic purposes, or if the lesions cause discomfort. Number 3 on our list is Palmar Arithma. Refers to the redness of the palms, commonly concentrated around the base of the thumb and little finger. This condition is often associated with various underlying factors, including liver disease, pregnancy, autoimmune disorders, or hormonal changes. The redness is caused by increased blood flow to the palms due to dilated blood vessels. While palmar erythema itself may not cause discomfort, addressing the underlying condition is essential for managing symptoms and preventing complications. Treatment options depend on the underlying cause and may include medications, lifestyle changes, or addressing specific medical conditions. Bringing us to number 4, pruritus, commonly known as itchy skin, manifests as a sensation of itching and can be either generalized or localized. This condition may arise from various factors, including skin dryness, allergies, insect bites, or underlying medical conditions such as liver disease, kidney failure, or certain infections. The itching sensation can range from mild to severe and may significantly impact an individual's quality of life. Number 5, we have petechiae. Petechiae are small red or purple spots on the skin that result from bleeding under the skin. These tiny hemorrhages occur when small blood vessels, known as capillaries, break and leak blood into the surrounding tissues. Petechiae can be caused by various factors such as trauma, certain medical conditions, or a decrease in the platelet count, which plays a crucial role in blood clotting. While often harmless, recurrent, or widespread petechiae may indicate an underlying health issue and should be evaluated by a healthcare professional for proper diagnosis and management. Let's move on to number 6. Ecchymosis refers to larger patches of bruising on the skin, characterized by purple, blue, or black discoloration. These bruises result from bleeding underneath the skin, typically due to trauma or injury that damages blood vessels. Ecchymosis may also occur spontaneously in individuals with certain medical conditions affecting blood clotting or blood vessel integrity, such as coagulopathies or vasculitis. Treatment typically involves managing the underlying cause and providing supportive care, such as rest, ice, compression, and elevation, RICE, for acute injuries. Number 7 on our list is telangiectasia, refers to dilated blood vessels that are visible on the skin, often appearing as fine red lines. These blood vessels, also known as spider veins or broken capillaries, can develop due to various factors such as sun damage, aging, hormonal changes, or underlying medical conditions like rosacea or liver disease. While generally harmless, telangiectasia may be cosmetically bothersome to some individuals. Treatment options include laser therapy, sclerotherapy, or electrocautery to reduce the appearance of these dilated blood vessels and improve skin appearance. Bringing us to number 8. Xanthelasma refers to yellowish plaques that develop on the skin, typically around the eyelids. These plaques are composed of cholesterol deposits and can vary in size and shape. Xanthelasma is often associated with underlying lipid disorders or conditions that lead to elevated levels of cholesterol in the blood, such as hyperlipidemia or familial hypercholesterolemia. Managing underlying lipid disorders through lifestyle changes and medication may also help prevent recurrence. At number 9, we have Terry's nails. Terry's nails are characterized by a distinct appearance where the tip of the nail presents as white, while the remaining portion appears pink or brown, resembling a ground glass texture. This condition, often associated with various underlying health issues such as liver disease, congestive heart failure, or diabetes, Terry's nails can serve as a visual indicator of systemic health concerns and should prompt individuals to seek medical evaluation for proper diagnosis and management. Let's move on to number 10, gynecomastia. Gynecomastia is a medical condition characterized by the enlargement of breast tissue in males. This enlargement can occur on one or both sides and may result in swelling and tenderness in the breast area. While it is commonly associated with hormonal imbalances during puberty or as a side effect of certain medications, gynecomastia can also be indicative of underlying health conditions such as liver disease, kidney failure, or hormonal disorders. Number 11 on our list is changes in skin color or texture. Encompasses a variety of manifestations including dryness, flakiness, or alterations in pigmentation such as a bronze or grayish hue. Dryness and flakiness are often associated with dehydration, excessive sun exposure, or harsh weather conditions, while changes in pigmentation may signal conditions like iron deficiency anemia, resulting in a grayish hue, Addison's disease, causing a bronze discoloration, or certain medications. Bringing us to number 12. Clubbing of the nails refers to an abnormal enlargement of the fingertips and nails, resulting in a rounded, bulbous appearance. This condition can affect one or more fingers and is often characterized by changes in the angle between the nail and the nail bed, known as Lovey-Bond's angle. It can also be a sign of certain infections or genetic disorders. Prompt medical evaluation is essential to determine the underlying cause and appropriate management of clubbing of the nails. Thank you for watching our video on 12 skin signs of liver damage you can't ignore. We hope you found the information helpful and informative. If you enjoyed this video and found it helpful, don't forget to give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss our future content. Remember, your skin can often provide important clues about your overall health, so it's essential to pay attention to any changes and consult with a healthcare professional if you notice any concerning signs. Stay tuned for our next video, and until then, take care of yourself and prioritize your health. Thanks again for watching, and we'll see you next time.